Hello, this is Lorna Lynn. I am a general internist and I'm the Vice President for Medical Education Research at the American Board of Internal Medicine. But in the 1990s, I was a primary care physician for people living with HIV. That's work that meant a great deal to me, both professionally and personally. I'm here today with Jesse Milan. Jesse, would you introduce yourself to the group?
I'd be happy to. Thank you so much, Lorna. I'm Jesse Milan. I'm the president and CEO at AIDS United, which is a national organization focused on ending the HIV epidemic here in the U.S. But I also serve as the patient representative on the Infectious Disease Board for the American Board of Internal Medicine. And I'm very happy to be here today to talk with you about the PEPFAR program and its importance on global health and for people living with HIV.
Well, we really appreciate your taking the time for the conversation today. Now, as I understand it, the President's Emergency Plan for AIDS Relief, or PEPFAR, was created in 2003 by President George W. Bush, and it has provided funds for HIV testing, for prevention programs, and for treatment of HIV in high disease burden countries. The funding looks like it's been stable at about $7 billion annually since 2008, and the program has been credited with saving more than 25 million lives. So it's a program that really makes a difference, and it's generally had bipartisan support. It's been continued through both Republican and Democratic administrations. And as I understand it, it's made the U.S. look really good in the countries where help is being provided. It's generally been reauthorized every 5 years, and that reauthorization was due in September of this year, but it wasn't reauthorized by the deadline. So we're going to talk about that reauthorization. But first, would you share with us your views on the value of PEPFAR? What's been accomplished because of this funding?
Well, Lorna, thank you for that question. I've been living with HIV myself for 40 years, so I very much understand the importance of this program and of the epidemic. I serve currently on the scientific advisory board for PEPFAR, so this is very professionally important to me. And most recently, I now am appointed to the Presidential Advisory Council on HIV, and I'm now serving on the Global HIV/AIDS Committee. So PEPFAR has so much a part of my work, and it's part of my advocacy. Since President Bush announced it in the State of the Union, which I think is really important to understand, he made this announcement creating the PEPFAR program in the United States State of the Union. He wanted the whole country and the whole world to hear how important it was that the United States have leadership for ending the HIV epidemic. And if we think back to 20 years ago when he made that statement, we were still living under the scourge of many, many deaths, over 1 million a year, hundreds of thousands of new infections worldwide. The opportunity for us to move forward to stop deaths and to stop transmissions was what this program was all about. And so over these 20 years, we've seen a tremendous result. I think many people think of the PEPFAR program, as the Marshall Plan for global health. And the United States should be very proud that we have helped save 25 million lives. And that includes 20 million people who are now on antiretrovirals, when that number, 20 years ago was barely a couple million. And so this is really a great success. But of that 25 million, we've also helped prevent 5 million births from children, babies being born with HIV. So it's a remarkable story. But the infrastructure that's been created by PEPFAR has helped so many countries. PEPFAR now supports efforts in over 50 countries. The public health infrastructure has been substantially improved in countries all across the global south, particularly, that had inadequate facilities for addressing this major pandemic. And that has been a really big success of the PEPFAR program. So has been the increased number of people in the public health workforce. Over 340,000 new public health officials and public health professionals have been trained through the PEPFAR program. That includes nurses and doctors and internists and community health workers. So the success of PEPFAR has not only been about the individual lives it saved, but about the infrastructure it's created that is making uh, access to healthcare much more present for people all around the world.
So 25 million lives saved, 5 million babies who were born free of HIV, better public health systems in 50 countries throughout the world that would have payoff with all kinds of other health problems. So, what's the problem? Why would such a remarkable and successful program not be reauthorized?
Well, I think we are living in the stalemate of the uh, U.S. political system where we have many Republicans who are concerned that the expenditure might be more than the American people should be funding, and concerned about some political agendas that they perceive are being promoted by PEPFAR, when in fact PEPFAR is a program that for its 20 years has essentially received bipartisan support all along the way. I was at an event just a few months ago where Lindsey Graham was awarded, given a great honor because of his support for the PEPFAR program. And in the same event, Nancy Pelosi received an honor. So it has a history of bipartisan support. But in this moment in time, and we're talking, just days before the November 17th deadline for the current extension of the federal budget expires, we're dealing with a very contentious and divided Congress. And we're dealing with many, particularly on the Republican side, who are pushing an ideological agenda that, in their minds, is in conflict with what PEPFAR is all about. Because we know that the PEPFAR program is about a primarily sexually transmitted disease. But they're concerned that PEPFAR has been promoting abortions and sex work or an LGBTQ agenda is simply not true. What PEPFAR does promote is access to prevention, treatment, and care for all populations that are highly impacted by HIV and that are vulnerable to HIV. And it does that without any kind of ideological concern about who the people are, but a great concern about those people, all people, getting access to care so that they can stop new transmissions or live a long and healthy life. And that ideological conflict is, I think, what is stopping the reauthorization of PEPFAR that technically should have happened by September 30th of this year and hasn't yet happened.
It sounds like if you have a pro-life agenda, then a program that has saved 25 million lives and led to 5 million healthy births would be something you could support.
That's right. And reauthorization is important because it's not just giving us the opportunity to refund the program year to year to year. Reauthorization basically says that the legislation that creates this program will stand for another 5 years. And as the global leader for public health, our Congress helps the United States say to the world, we are committed to this program, not just to fund it for, oh my gosh, another month or two or three, or maybe even a year, but that we have a long-standing commitment. And that commitment is particularly important because people like me who are living with HIV, we're not going to be on these drugs just for another day or another month or another year. We're going to be on these medications for the rest of our lives. And the PEPFAR program, by reauthorizing it, it's saying to the global community, we're committed for another half decade to this, another 5 years, and possibly in 5 years beyond that, and 5 years beyond that. It does give us a chance to look at what's in the legislation, but not reauthorizing it is simply showing the world that the American people might be inadequately committed to the PEPFAR program, when in fact, it's such a success, it should be among the first things that we're committed to.
Well, as you well know, the American Board of Internal Medicine certifies individual physicians who are dedicated to providing high-quality health care to their own patients. I think most of us care a great deal about high-quality health care throughout the country, throughout the world. So what can I, as an individual physician, do to try to move forward the reauthorization of the program?
Well, I think all of us who are voting American citizens should be in contact with our members of Congress, both our senators and especially our members in the House of Representatives, to let them know that we are committed to supporting global health around the world, and we're committed to helping people living with HIV continue to get the medications they need around the world, and we're committed to stopping new transmissions around the world. That uh, every new transmission and every death from every illness from AIDS and every death from AIDS, of course, not only have emotional charges for all of us, but they have an economic impact as well. And the investment that we are making in PEPFAR is actually saving us billions of dollars from major destructions, because we could be having hundreds and hundreds of thousands, if not millions, of people dying every year, as we did at the beginning of the epidemic. We're averting all of those costs by having people stay healthy, having them commit to participate in their own country's economies. We're helping to shore up what is needed for a great economic success for our world. But not having PEPFAR puts us in great danger. So let your Congress member know that you support global public health and you especially want to see the PEPFAR program reauthorized.
Thank you for that. I will be contacting my senators and my congressperson later today. As I think back over the years of the HIV epidemic here in this country, in the early 1980s, we didn't even know initially what caused it. There were no treatments, and then the first treatments were so toxic. There have been such tremendous advances in the science that have not only helped us in the treatment of HIV, but in so many other areas. HIV, as you have said, is now a chronic and manageable illness for those who have access to the treatment. When you think about HIV, what do you see as the greatest needs that must still be addressed for us to make progress in addressing this problem through the U.S. and throughout the world?
Well, one of the greatest needs is to continue to break down the stigma around HIV. I think one of the major drivers that prevent people from knowing their status and even staying in care is the fear that they will be maligned, that they will be rejected, that they will not be loved. And that stigma starts in the home, and it permeates all across our communities and all across the world. Discrimination is still a very significant factor. People are afraid that if their HIV status is known, they may be fired, they may be kicked out of their homes. And there are criminalization laws that are still on the books in countries and even in over 20 states in the United States that are based on antiquated scientific knowledge about how HIV is transmitted, like spitting and biting, that kind of thing. So the stigma and discrimination of HIV, we must break those down. That is a great need. But I think we also have a toolbox that prevents new transmissions and makes it possible for people to live long and healthy lives. And that toolbox includes PrEP. We do not have enough people in the United States or around the world who are accessing PrEP. PEPFAR is helping a million people get on PrEP, but we need obviously many, many more people to be on PrEP so that people can take control of their own sexual health by taking PrEP. That can stop a new transmission to you. That's huge. We also have what's known as U equal U, where if you're on the antiretrovirals successfully and you achieve an undetectable viral load, your virus is untransmittable to someone else. So we have the tools we need, because if you are a person living with HIV and you achieve an undetectable viral load, you can't transmit this to someone else. So with that and with PrEP, we can stop all new infections, but we do not have enough people yet on antiretrovirals. Only 20 million of the 36 million people living with HIV are currently on antiretrovirals and headed toward that undetectable status. So we still have another 16 million people who need to get on antiretrovirals around the world. And we have hundreds of thousands of people here in the United States who are not yet achieving viral suppression as well. And I think we need to understand that the needs for people living with HIV are not a one and done situation. You don't just have an undetectable viral load today and then you're done for the rest of your life, which could be another 20 or 30 or 40 years. It's wonderful that we have these antiretrovirals that make it possible to live. But if I'm 55 today, I want to get to 85. If I'm diagnosed at 35 today, I too want to get to 85. We need to understand that support and access to care and medications is a lifelong journey for people living with HIV. And we need our decision makers, especially in Congress, to understand that this is not just a problem for today. It may be a problem that needs a solution for access to care for decades and decades.
So, what you're talking about with pre exposure prophylaxis, with ongoing treatment so that someone has an undetectable viral load, these are steps that could eliminate HIV from, from our country and throughout the world with adequate treatment. I imagine that the adequate treatment depends on adequate funding. These medications are not cheap. Any thoughts on that?
Well, that's one of the reasons why the PEPFAR program is so important, because it is providing medications and support from uh, uh, and inspiring support from other countries through the Global Fund to provide access for people to have medications. But the foundational support has always been from the PEPFAR program. In the United States, the AIDS Drug Assistance Program does make it possible for people who have no medication or who have no insurance and who are obviously living in poverty to get access to HIV medications. And frankly, the Affordable Care Act in the United States has been a great boon for getting people to have medications. But worldwide, we're talking about the global South, where their economies are not yet quite what we want them to be, and the PEPFAR program is making it possible for people to have access to medications. Because without the PEPFAR program, we would be having millions of deaths every year.
I want to go back to your comment about the stigma and the discrimination that still exists. What would you say, again, to individual doctors who would like to make a difference? What are some steps that we can take in our daily lives, in our professional lives?
I think in the privacy of the examination room, you're showing that you are listening to your patient, that you are a safe space for your patient to discuss what their great concerns are. If your patient is negative and they uh, feel that they can share with you that they may have some sexual health issues that they'd like to discuss, the opportunity to get a prescription for PrEP is in that moment where that level of trust is so strong that a patient can actually say, this is what I'm doing. I want to protect myself. Can I get a prescription for PrEP? Or what would you recommend? And I think that is a wonderful space for people like myself who are living with HIV. Those spaces are also times for us to talk about everything, our whole health. I once had a doctor who I was seeing for many, many years. And I said, I'm a Black man of a certain age. Is there something we should be talking about in addition to my HIV that might be impacted because I have HIV? And he'd say, oh my goodness, you're absolutely right. So listening to our patients, giving us the opportunity to share all that we're concerned about, because in that one moment, you are our guide, our guru, and our physician to help us navigate all that we may be facing in our personal health journeys.
Every year on December 1st, we recognize World AIDS Day, and I think that brings to consciousness for some people who may not be thinking a lot about the HIV epidemic or think, oh, it's so much better now. So as we approach that date this year, I'm turning to you as a national leader for many years in developing policy, providing funding to many organizations to help address HIV locally and nationally. You've been doing this work for a long time. What you said today gives me a lot of inspiration and more hope. What gives you the most hope today that you would want to share with those listening to us?
Oh, Lorna, thank you for that question. I try to live in a state of hope. World AIDS Day was in many ways created as a commemoration to remember all the people who have died. And, we're talking today, still 36 million people have died over the course of this epidemic. And I remember them. But those people, uh, their deaths, um, their deaths are precious to all of us. But the opportunity for us to stop any new deaths is what World AIDS Day can also be about. How do we continue to move forward so that people do not acquire the disease and that those who are living with HIV never transition to AIDS or developing AIDS and dying? And so I have great hope because in these last few years, we have a new lens that we're looking at, which is not new for some of us, but it's a new approach that many are taking that we should be addressing health equity. And so when we look at the global pandemic, it also is very much consistent with the global Black diaspora. So if you're concerned about racial health for people who are particularly Black and Brown, including Native Americans and people around the world, that opportunity for you to say, I'm committed to global health and I'm committed to health equity for people of different races and backgrounds, HIV can be your pathway to show that commitment. If you're concerned about LGBTQ health and human rights, the HIV epidemic is very much centered, of course, in the LGBTQ community, but not exclusively. In the United States, very much so, but not necessarily globally. But even in global arenas, LGBTQ people are being maligned and discriminated against. So I have great hope that we are thinking more and more around health equity also from an LGBTQ lens. And I have great hope because science is continuing to advance. Injectables that can happen maybe once every 6 months for your HIV treatment or even for PrEP, that's a great step forward. And of course, after all that we've been through on the COVID pandemic, we know that vaccines were created a lot because of the research that already existed around HIV vaccine development. And so a vaccine is still in our future. And that too gives me great hope.
Well, Jesse, I want to thank you for sharing your hope, for sharing your wisdom, helping me to know what I can do as an individual to address the immediate problem of reauthorization of PEPFAR, but also to take additional steps to assist communities and the people that I care about. Thank you so much.
Thank you, Lorna, and thank you, ABIF.